Now we're going to talk about Toxoplasma gondii. Toxoplasma gondii is a CNAS parasite or protozoa that has three stages. One is in oocyte, next is in tachyzoid, and bradyzoid. We're going to talk about this in other videos. This is just a fast review. The oocytes are in the feces material of the cat or in the uncooked meat, and this is the infected form that we ingest. The tachyzoids are in the reproductive stage, the fast reproduction, and bradyzoids in the slow reproduction stage. So the diagnosis is with serology of tachyzoids, but the infection form are the oocytes. In the clinical symptoms are just flu-like or mononucleosis-like, but the monospot test would be negative. If the mother is infected with this, can transmit it to the fetus. If it's in the first trimester or early in the pregnancy, could present with the Torch syndrome, that is microcephaly or hydrocephalus, chorioretinitis, and intracranial calcifications. If it is late in the pregnancy, we present with blindness and none of these things. The diagnosis is with serology, that's like the confirmation diagnostic. For the mother and the child, we should be careful to not confuse if we have IgG, that we will not know if it's from the mother or for the baby. If we have IgM in the baby, that would be infection of the baby. Usually we do not need to do serology, and we just treat empirically. That is, Toxoplasma gondii usually infects immunocompromised patients. So presents first with ring enhancing lesions in the MRI. We could visualize this in MRI or CT scan, and the most common cause of solitary ring enhancing lesion would be Toxoplasma gondii. So we treat with sulfadiazine and pyrimethamine. If the patient improves, then that was the diagnosis and there is no further treatment. If it do not resolve, then we continue to do biopsy or things along that line in order to see if it's not like B-cell lymphoma, that is the second most common cause of ring enhancing lesion in immunocompromised patients. But so there is usually no need to do serology nor biopsy in order to do reverse transcriptase PCR or PCR or something along that line. So usually we do not perform biopsy nor serology, just with MRI and the empiric treatment. This is seen when the count of CD4 cells is less than 200 for immunocompromised patients, and the treatment is pyrimethamine and sulfadiazine, but in pregnancy we prefer to give spirimycin. Spirimycin is better in pregnancy, and in pregnancy it's strictly forbidden to have cats for the pregnant woman because of the potential effects that can produce to the fetus.